This video is for education and entertainment purposes only. Please consult with your healthcare provider before making any changes to your health plan.
Hey, beautiful soul. It's Jacqueline from the Labia Chronicles, where I talk about all things lichen sclerosus. So if you have lichen sclerosus and are looking to empower yourself with information, find acceptance, and reclaim your life, then please subscribe to this channel and keep on watching. And if you have a friend, family member, or loved one with LS and you want to learn more about lichen sclerosus so that you can support them in their journey, then please keep on watching and share my channel with them. All right, I am beyond excited about today's video. I've been wanting to do this for such a long time, but it has been just so challenging to find somebody to bring on. So today the topic of our video is the procedure called a clitoral lysis of adhesions. Now, I've spoken about this, I've written blogs about it, I've done videos on it. And whenever I discuss this procedure, I discuss it very much from the point of view of what the evidence says. What do our studies show? What do case reports show? Because I myself have not had this procedure. And so when I can't speak from lived experience, I'll speak from, what the literature says. Now, as much as I love evidence-based research, I also think it is just as important that we highlight and center lived experiences. Now, I haven't had this procedure, and so I've not been able to talk about it from that lived experience perspective. And so I've put out calls on my social media, through my newsletters, asking folks to come on my YouTube channel and share their story. And there's such high demand for it. People are always asking me to bring people on to share their experiences. But whenever I put out a call, nobody answers. And so this late kind of 2024, finally, somebody did answer my call, and they have graciously decided to join me today and talk all about their diagnosis story, their clitoral lysis of adhesion procedure, advice for anybody considering it, so on and so forth. So that's what we're going to be doing today. So I'm so excited. We're going to be talking to Chelsea today. She is phenomenal. She's a physician's assistant. She's had LS since quite a young age and has been through quite a lot. I think you're going to learn so much from this video. So with that, let's jump into things. Now, before I bring Chelsea on, really quick, we're going to do like a Coles Notes one-on-one, really rapid fire. What are clitoral adhesions and what is the lysis of adhesions procedure? So really quick, we've got my little vulva puppet that many of you are familiar with, right? So this navy blue part up here, that's the clitoral hood. You pull that back, you have this kind of pink little ball, that's the clitoral glands, and then you have the inner labia, the outer labia. This white part in here is the vestibule, which houses the urethral opening up here, the vaginal opening down here, and you got the posterior fourchette and the perineum, kind of there. But anyways, disregard all of that. What we're really focusing on for today is the hood and the glands. So a clitoris that has no adhesions, if you take the hood, you can very easily pull it back to expose the glands. Now, everybody's anatomy is different by default, and so some folks will automatically have it where you can kind of see the glands even at rest. For other people, that hood will hang completely over, but suffice it to say that that hood has a lot of mobility. It moves very easily, and it can be pulled back. Now, sometimes what can happen is this hood can slightly stick to, scar to, and adhere to the clitoral glands, causing something that we sometimes will call fusing, right? So this part is stuck. So I might be able to pull it up on this side, but this side is stuck, and so there's no retraction. And so you can have different degrees of adhesions, right? Some people have a bit of adhesions on the left side, on the right side, and then you can have moderate, mild, moderate, and severe adhesions. Typically when the hood is fully scarred over that glands, right, where you try to retract and there's basically no motion, the scarring is so thick that there's no elasticity, it barely moves, no glands, that would be called clitoral phimosis. Now, sometimes when there's any degree of adhesions, there can be pain. You can get things called keratin pearls, which is where essentially dead skin cells and oils ball up under the hood. They get trapped. And because there's fusing, they can't get kind of outside, so they stay trapped under that hood. And it kind of, they'll say it feels like a grain of sand stuck in your eye, but way more intense because it's under the clitoral hood. So it can cause pain, tightness, pulling type sensations. And in the context of sexual health, it can for some people, not all, for some people, it can lead to a loss of clitoral sensation. So both of these are functional issues, and there are ways to unfuse and release those adhesions. You can do this non-surgically and surgically. I've written about this extensively. I will leave every blog post and video I've ever done on this topic. I also review the procedure in depth in my free ebook, which you can get at losslabia.com/LS ebook. So if you want more of the science, more on the procedure, that's definitely the place to go. Suffice it to say that the lysis of adhesions basically involves a clinician, well, a surgeon who will basically separate the hood from the glands, releasing all of those adhesions. So separating these two separate parts so that this moves again and the glands can be visualized, with the hope that that will no longer cause the person pain and that their sexual health will improve because they'll have more sensation now that this has kind of been released. So that is the lysis of adhesions procedure. Lots of folks have questions about this procedure, want to learn more, and especially they want to hear from people that have actually had the procedure. What was it like for them? Do they have any regrets? Would they do it again? Do they have anything they would do differently? Do they have specific advice they would give to the community? And so with that, we're going to bring on Chelsea, who's going to tell us all about her experience. All right, Chelsea. So thanks again for joining me today to talk about your lysis of adhesions procedure. I am so excited to have you here to speak so vulnerably and so openly on this topic. I know I get lots and lots of people asking for firsthand experiences, but it's really hard to get people to actively share their stories. So I'm so grateful for you for being here today. And we are going to talk about the lysis of adhesions, but I do want to start by just kind of hearing your diagnosis story. What did that look like for you? Because we're all so very different in what we go through.
Sure. Yes. Hi. I'm happy to be here as well. Happy to share. So I would say I started having LS symptoms around 24. I'm currently 31. And it kind of all started with I thought I had either like a vaginal yeast infection or BV. And I had a lot of itching. And I self-treated with Monistat, like the 7-day that you just get
Yeah.
from the store, where it's like a suppository. And I had just a crazy reaction. My skin puffed up really bad. It got hot and like tingly. And I was like, oh no, I really messed up. I did something wrong. So I went in. And at that point, I had a hormonal IUD in for birth control. And I thought that that was maybe playing into some of like the itching that I had been having. So I requested that I was going to have that IUD taken out. So I had my IUD taken out, and at that visit where she was doing the pelvic exam to take it out, she just noted it was like just a general like family practice. She said, I think you have something called lichen sclerosus. At that point in time, I wasn't, it was very much kind of just like a side comment. Um, and we kind of talked about other things in the visit. And then at the end, I was like, what does that mean? And I remember exactly what she said. She said that it's something that happens more often to fair-skinned people, which I have never read it really in the literature. So I want to just point that out right
Me
now. I don't think
neither,
that that
no.
is true. Right. So that's what she said. And then it was, very casual. And she just said, put coconut oil on at night for the rest of your life. And I was like, okay, you know what I mean? Like, you don't think that that's anything, like coconut oil is very benign. You're like, okay, not a big
Right.
deal. Like, I just need to moisturize or something cool. So left that appointment. My skin wasn't really getting better. Then I ended up actually having like a pretty severe skin tear on my perineum. So that skin between my vaginal opening and my rectum during intercourse, which was very weird for me. I had never had that happen before. And it was not anything like crazy, where I would have maybe thought that I was in the wrong,
Right.
where that could have happened. It was something I totally unexpected. So then I started thinking something is off, you know what I mean? Something is happening with my skin. So I went, we have a dermatologist in town. So I went to the dermatologist and they looked at my skin and they were like, something is going on. Let's biopsy you. So they did 2 biopsies, one from each labia, one from each side. And I remember they wiped the alcohol prep pad on my skin and it burned so bad and I started crying. And I remember the assistant said that should not have hurt. Like there's definitely something going on with your skin that should not have been painful. So I actually didn't even feel the biopsy or like the lidocaine injection because the alcohol prep pad hurt so bad. So they did the biopsy. It came back as actually lichen simplex chronicus, which
Okay.
is kind of like a sister condition, I would say, to LS, can happen in the same spots. So they started me on topical steroids for that. And it just was not getting better. It was getting worse. It was getting worse. At this point in time, my mental health was very, very bad with it. I was constantly looking in the mirror. I thought like 1 week into using this topical steroid that I had skin thinning already from the steroid. I was going out of my mind. I was very, very worried and just kind of off the rails. And the steroid didn't really seem to be reining in like the reaction that was happening where my skin was really puffy and hot and angry. So went back to the derm and they couple times and they were like, gosh, we really don't know what to do with you. So they sent me to Mayo Clinic, which
Okay.
is actually only about an hour away from where I live, which was great though, because I think even when you live around here, like the Mayo Clinic, like you hear that and it's very
Yeah.
synonymous with like world-class healthcare. So I was like,
100%.
sweet, I'm going to be taking care, really good care is given here. This is cool. So they actually have a specific vulvar derm clinic at Mayo Clinic and very hard to get into. There's only a few appointments a month because how it works is you go into the appointment and they have a dermatologist and a gynecologist present together in
Oh,
the room during the
nice.
appointment,
Okay.
and they both evaluate you at the same time. So it's
Very
great.
cool.
So I went to that appointment and they actually requested the pathology slides from the derm to have their pathologist read them again. And they said, our pathologist doesn't agree. Our pathologist thinks it's like some eosinophil infiltrate, which is these cells that kind of react when you have like an allergic reaction. So they were like, they heard my story and they were like, we think you had an allergic reaction monostat. We think it just was never properly treated. They put me on tacrolimus ointment, so a non-steroid, but still an immune suppressant ointment, for 3 months with a taper. I did that. My skin was feeling great, actually. I went back in for my follow-up. They were like, your skin looks great. And they kind of were like, okay, bye. Hope to see you never. And I was like,
Right.
same.
Yeah.
Elated.
Of course.
I was like driving away. I was like, oh, this is awesome. Like totally
Mhm.
dodged like a chronic condition bullet. You know what I mean? So went home with time, skin started to regress again because I wasn't putting anything on my skin at this point in time. So kind of reached back out to Mayo. And then that kind of started probably 2 years of just kind of chasing this diagnosis of me being like, something is wrong. I know something is wrong. I think how a lot of people who have LSR is you just know that it doesn't feel right.
Oh, yeah.
And so over the course of those 2 years, had a few follow-ups, had another biopsy that came back as just inflammation. So this whole 2 years, they were not prescribing me steroid ointments to put on my skin because they said we have to have biopsy proven LS to prescribe you topical steroids, was their stance. And I was going crazy because I was looking at my skin a lot. I was watching my skin change. I think a lot of people with LS, like you don't look at your skin a lot and then you look at it and all of a sudden it's changed. I was going crazy because I was watching it change. And it was like this train that I was watching just go into the sunset. And I was like, my labia are leaving me. You know what I mean?
Yeah.
I
That's
had a really
terrifying.
hard time with it mentally and emotionally. Yes. So kept chasing it. Eventually, I went in locally it was something pelvic related. It was probably the fact that I was so uncomfortable, had a lot of burning and stuff. They took one look at my vulva and they said, whoa, there's something going on. And I said, well, Mayo was kind of watching me, but they don't think, they haven't found LS yet. And this provider was like, you need to go in and be seen by them again. Like this, you need to have them see it right now how it is. So I sent them a picture that day and the derm said, yep, you need to come in. That looks like classic LS is happening in your skin. So I was a little frustrated because I felt like it was one of those things where I felt like I was really lucky because I was almost on top of it. And then I feel like the system, just the way things are, kind of forced me to like lose some of that preparedness in like tackling the diagnosis. So I went back in, they biopsied me. So I was like my third biopsy. And this biopsy, they actually found LS. So hallelujah. I mean, I feel like it's really sad when you get that label or that diagnosis, but you're having the symptoms anyway. You know what I mean? So I think like all of us, it's very bittersweet because
Yes.
you have an answer. It's not the answer you want, but the answer comes with information, and information is so empowering. And so then from that point on, that's kind of when I started doing my like routine steroid routine, and just treating it, and kind of like knowing that I have that, seeing things on the internet about LS. I watched your videos all the time. I would look at the LSSN website all the time.
Mhm.
Yeah, so that's kind of it in a nutshell.
Yeah, man, that is so, so wild. And I think one thing that really stands out is like the challenge for healthcare providers to give an early diagnosis. So early stage mild LS is very, very challenging to diagnose because there aren't these screaming loud clinical signs in their face that show like clearly LS. I feel confident in this diagnosis. And often, like what happened is you'll get biopsies that just come back as non-specific inflammation. And I always tell people that's a really frustrating thing to get back because it's so uninformative. Like you went through the
Mhm.
trauma of a biopsy to just get non-specific inflammation, which can be caused by so many things. So, and they don't usually do anything about that. So it's really challenging for them. And it's also very frustrating as a patient because, and this basically happened to you, it's like you almost have to wait for it to
Mhm.
get bad enough for you to have those screaming clinical signs for them to be like, oh, okay, now we know, and now we'll either biopsy or, depending on your country, we'll go straight to steroids. Like in my case, my symptoms started in my early 20s, took me until 31 to get my diagnosis. But I had to progress to the point where my vulva was white, like this fake background, where all my anatomy was lost, clitoris scarred over, like everything at that point, like they couldn't deny it, right? And it just
Mhm.
frustrates me, like you're talking about like watching it unfold and like literally watching your labia like disappear in front of your face. And it's so frustrating that from a diagnostic point of view, we're at the place where we almost need that to happen. And like I can appreciate too like the challenge because we also don't want to throw steroids at a case that doesn't have LS, that doesn't necessitate topical corticosteroids because they can come with some nasty side effects if there's no, skin condition. So we don't just want to throw it there either. But I'm just hoping that down the line, we're going to get better diagnostic tools such that we can make those diagnoses early and catch it early and not need to, like in your case, like in my case, like so many of us have to wait for it to progress so far and we lose so much for them to finally say, yeah, okay. Because if we catch it early and we start treating early, a lot of those changes could be avoided. And so that's
Right.
really, really frustrating. But I'm still really hoping that we're going to see a change in the way that LS is diagnosed in the future. So we're talking about things changing, things, on our vulvas, parts of the vulvas changing, losing parts, parts sticking together, fusing, adhesing. Let's talk a bit about any kind of anatomical changes and when you started noticing things were off and how the lysis kind of played in. Because we've got the diagnosis, we've got the corticosteroids, we're starting to treat. How do we get from there to like the lysis?
Sure. So I would say, when it started out, I had a terrible habit of looking at my vulva like many times a day in the mirror. I think for people who get LS who are very type A, it's you definitely develop a
Yeah.
lot of like health anxiety. And it's a little bit of almost an OCD type pattern where it's like a obsession with your skin, and
Mhm.
that compulsion is checking, and you get that like very mild reassurance from looking,
Yeah.
and you just can't stop it. And so I was doing that a lot. And I think sometimes, like your hair, like when you see somebody every day, you don't notice their hair growing. But when you haven't seen them in a long time, all of a sudden, whoa, you
Yep.
notice that big difference.
Mhm.
So I think I was looking so frequently that it took me a long time to notice some of the anatomy changes that were happening. I definitely would say that my inner labia, the minora, shrunk a lot and definitely kind of like fused and agglutinated to
Mhm.
my outer labia. So I lost a lot of that architecture. And as far as my like clitoral area, I was applying my medicines there, but I guess like at that point in time, I wasn't really aware of the issue of that hood fusing down and then your
Mhm.
clitoris kind of becoming like inaccessible in a way.
Yeah.
So I wasn't really visualizing my clitoris, you know what I mean? Like when I was doing a skin check or when I was putting ointment on, like ointment was getting around that spot, but I wasn't being super diligent about it.
Mhm.
And so I would say it was, I would say it was really probably after I had my son, who is now 3. And I kind of looked at my skin for the first time postpartum that because I think you take a break kind of, with intimacy postpartum.
Yeah.
And my husband and I were really kind of trying to like ease back into that. And things just didn't feel the same. And I was like, something is wrong. And I'm going to share everything today. But
Yes, I love it. No, I'm
so
here for this.
so I feel like I am definitely somebody who needs like clitoral stimulation to
Yes,
orgasm. And
same.
so what I noticed was like that sensation wasn't there. Like everything felt very buffered. Like you could
Mhm.
tell that things were very desensitized. So that's kind of what triggered me to look closer at my actual like clitoral hood area. And when I looked at it, I was like almost kind of like, where is it? Like I knew anatomically where to look for my clitoris, but I really couldn't see it because it couldn't be visualized anymore. Because like that hood, like if you see, any pictures of anatomy, or if you look at your own anatomy, if you still have a clitoral hood, kind of just like what you think of like a sweatshirt hoodie, like it kind of comes over and kind of protects that clitoris. And then the nice thing is like then if there is some clitoral stimulation, it's not fused down. And so when blood flow and things go there and it swells, like there's room for that to expand a little bit. So what was happening was it was like I was getting really frustrated and, probably like many people, intimacy and my skin is a large source of like frustration with my relationship with my husband. He's great about it, but I think no matter how great your spouse
Of
or
course.
partner is, like you are frustrated, they're frustrated. It's a frustrating situation.
Mhm.
And so, what was happening was I was like, I became like desperate then at that point. I was like, no, this has to work. Like, you know what I mean? Like, we have to get our sex life back. Like, I can't lose this too, right? Like, I can't lose my sex life. I can't lose my anatomy. Like, I can't be losing everything. I'm, 28 or whatever.
Mhm.
And what would happen would be that any type of stimulation to that clitoral area, because stuff was so fused down, started to really hurt. And it started to almost like ache, like
Mhm.
not to be like I almost equate it to like when guys use that term like blue balls, like if they get
Yeah.
stimulated,
Mhm.
it felt very achy. And there was nowhere because like that, there was nowhere for that like
Yeah.
swelling of that clitoris to go. So then it was very frustrating because I was like, I don't want to touch it. Like, I don't even want to try. Like, this is not successful.
Mhm.
So I think for me personally, because I am so type A and I'm a physician assistant now, and so I have a healthcare background, I've always been what I would consider very proactive with like my treatment of my LS and probably what other people would consider aggressive with my treatment. And so I also have the Mayo Clinic like an hour away, and
Mhm.
there, subspecialties upon subspecialties there. And so I reached out to someone local and I said, hey, like my clitoral hood is fused down. Who would I need to see about this? And that was like the general surgeon here in my hometown. And they kind of did some digging and they were like, this is somebody you could see at Mayo in the, gynecology department who does that. Um, so so I think like so my motivation, I feel like for doing it, um, I think a lot of the motivation was like honestly frustration because I felt like it was like yet another thing that I had no control over. And I
Mhm.
was really frustrated with myself because I was like, maybe if I would have been trying to visualize my clitoris, like when I was putting my ointment on and making sure
Right.
I was moving that hood and making sure I was doing these things and getting emollient on that hood, maybe I could have prevented this. And so at first it was kind of just like a knee-jerk reaction to being like, I can try to fix this.
Mhm.
Um, and then I also think that part of it too was I think when you're diagnosed with LS and you're younger and you're in your reproductive years and you're still very interested in having like a sex life with your partner, part of it was for my husband as well. You know what I mean? Like I wanted us to be able to like enjoy that part of our relationship. And so I was like, oh, like maybe there's something I can do to help with this.
Mhm.
So I had a consult at Mayo. And so this was a doctor I'd never met before. And I
Okay.
think when you have LS, like my strategy is kind of like I pick my one person, they do skin checks for me. like you develop a relationship with them. And it's really good when you're able to have that one person because they know what your skin has looked like in the past. It's another set of eyes that like knows that frame of reference for like, it is your skin looking good right now, like for you and for how your skin looks. So that was a little bit daunting, just going and having, you know, this like older man look at my skin. And usually I'm fine with people looking at my skin, but it definitely is a different game when you're thinking of somebody like cutting near your clitoris. And I would say it didn't really hit me until I had already agreed to do it. So I like had the consult and the doctor came in, you know, and he looked and he was like, yep, like, you know, there's some anatomical changes from LS. There's, you know, the clitoral hood is fused down. Like, yep, we can go in and we can like separate this for you, you know, kind of like no problem, whatever. And he was very experienced. I mean, he's been doing it for probably 40 years. So I felt good about who was as good as I could have about who was doing it because it wasn't going to be someone who I had an existing relationship with because I just didn't know anyone in gynecology surgery. Um, and then I feel like I went for the appointment and that morning I freaked out a little bit. Like it's like, okay, like I was feeling okay. And then it kind of really hit me that I was like, what if I make things so much worse? Like, what if my like knee-jerk reaction, now I'm going to regret this. Now I'm going to leave and I'm going to have something done that I can't undo. And so I was kind of freaked out the morning of, and I remember talking to the surgeon and I just said, I was like, please err on the side of doing less because my concern is that you're going to open this up and then I'm not going to be able to walk or sit or do anything without my clitoris being like rubbing too exposed. I was so worried about it swinging the other way. So I did tell him that and he was like, okay, like, you know, that sounds good. Like we'll be like kind of conservative in our approach. And so they did this procedure, came out, and I didn't know this at this point in time. It maybe would have been nice, but I think this was a little bit of like a game time decision by the surgeon. So instead of just kind of separating where that hood was fused down, he separated it and then he actually kind of like tucked the edges a little bit and sutured them down. Because he said in his mind that strategy would hopefully help refusion because you weren't just kind of slicing skin and then letting the same two inflamed pieces of skin kind of touch and rub again. He was hoping that kind of getting like a fresh piece of skin down there making contact would help it kind of like stay unfused, which after the fact, I mean, now it doesn't bother me. In the moment, I was a little peeved because I was like, wait, you know what I mean? Like I was like, that wasn't what we had talked about. Like you hadn't mentioned that. What if I don't like that part of it? So at that point in time, I was a little bit worried about that. But
were you
I also at
under?
the same
Like
time,
you went under for the procedure? Yes, you did.
Yep.
Okay.
Yeah. So I was completely under. So when you know, when he came to round on me afterwards, he had talked about that, but he was like, you know, it went really well. And so afterwards, just a ton of swelling, as you can imagine. There isn't a whole lot of places for vulvar swelling to go. So ice, like ice is your best friend if you get it done. Constantly be icing on and off. So I just did a lot of icing afterwards. And then they had given me some lidocaine gel, which I have not really been able to find afterwards. And now working in gynecology, it's kind of a specific gel that they use for procedures. So they had given me like what was left of what they used in the procedure. And that was actually really nice because like the gel texture was really helpful compared to maybe like a thicker ointment. But I did use like coconut oil. I had some lidocaine ointment at home. So I just kind of tried to keep it very lubricated with like an emollient at all times. And iced. And then I would say, honestly, the biggest symptom I had after having it done was just insane itching because of the fact that there were sutures down there now. And it's like such a sensitive area and sutures are so pokey and so irritating. So I would say just a lot of itching, but for people who have it done, just understand that like that's going to go away. I, you know, I knew it was going to go away and I still called them and I still said, I'm going crazy. It's so itchy. Like you need to talk me back off the cliff. And they did. And I think a lot of people who work in like vulva and gynecology are very good about talking people off the cliff and they do it all the time. Yeah, so I would say a little bit of like I hesitate to call anything regret with my skin because I feel like that's a really unfruitful emotion to have because what could you have done? You know what I mean? Like you made a decision
Right.
based on how you felt at that point in time,
Hmm.
and you just kind of have to go with your gut sometimes. Um, but about maybe a month after when I was like, okay, all of the swelling should be gone, I was still just very nervous because things felt so overly sensitive. And even though I had told them to kind of be conservative, I personally was like, oh my gosh, my clitoris is just like out now. You know what I mean? Like
Right, right.
if I sit and if my legs are spread apart even a little bit, I feel like it's just like out in the wind, just, being
Yep.
exposed to everything. And so I remember calling the surgeon about that. And he had said, I really think you just need to give it more time. Like, even
Okay.
though the visual swelling has gone down, like there's still a lot of swelling, there's still a lot of inflammation
Right.
on like the tissue level. So I took his advice, and I would say by probably like month two afterwards, I wasn't at all bothered, wearing clothes or
Okay.
like having, stretching or doing anything like that. Um, so I'm glad that kind of dissipated like he had said it would. So I feel like if there's anyone who gets it and like immediately afterwards, they're like, oh my gosh, this is exactly what I was worried about. Now it's
Mhm.
just out there. Now it's too oversensitized. Like I can't stand this. Really just try to like give it some time because I do think that there is so much swelling that we don't really know is still there.
Mhm.
And it eventually settles down.
Yeah, that makes a lot of sense. I'm curious to know about like communication between you and the surgical team throughout. So let's start with before the procedure. Did they tell you anything to do to help you prepare for the surgery, or were they just kind of like show up and fest?
You know, yeah. Thinking back, I feel like it was kind of just like a show up situation.
Okay.
And then, it's very similar to any other like same day procedure. You go, they walk you through all of the pre-op things, you meet with anesthesia.
Hmm.
The surgeon comes in and talks to you again about the procedure, and then you kind of are wheeled off. So really, like I don't know a whole lot of like what went down because it was kind of like, if you got a colonoscopy or something where it's just like you're there and then they wheel you back and you're kind of like, okay, bye,
That
as
is
they put you to
exactly what I
sleep.
was thinking about, probably because I had one not too long ago. So that was like
Yes.
going through because everything you said was the same thing for the colonoscopy. So,
Right, right. Yes.
mhm.
Yeah. So kind of one of those where you're there and then they say, start counting down and you're like, here we go. And you're like, just like crossing your fingers. And then, all of a sudden you're back in your room or you're back in like the PACU area. Um, yeah. So there wasn't really any preparation that I remember that they had me do for it.
Okay. And then how about after? So some specialists have like specific aftercare sheets that they will give to their patients to help ensure that the surgery is as successful as possible. And that sheet also includes things like any changes to your steroid. As the swelling goes down, sometimes you're going to use the steroid more frequently, less frequently, so on and so forth. So was there any kind of aftercare sheet, or did they give you any specific guidance on what to do afterwards as you healed?
Right. So there was an aftercare sheet kind of, first of all, just with the general things,
Yeah.
about like bathing and submerging and your stitches and things like that, icing. As far as like LS specific things, the surgeon had just said, I just want you to return to your normal scheduled like steroid use. So at that point in time, I was just using it like the twice a week.
Okay.
And then I was just like very liberally using emollients and stuff in between that. And then like
Yeah.
lidocaine things just to try to like numb it a little bit while it was healing.
Okay. Yeah, no, that makes a lot of sense. And so you mentioned like itching, like which the
Hmm.
second you mentioned stitches and like just healing, I was like, yeah, okay, that unfortunately does make sense. But how was the pain post procedure? I
Hmm.
think like that's something that I would be nervous
Right.
about if I was going to go in. I'd be nervous that like I'd be in so much pain and so much discomfort, especially given where it's located on the body. It's kind of hard to avoid it. Like even if you're lying down for a few days, like just getting up to the bathroom, that friction, you're going to kind of always aggravated a little bit. So how was pain and how did you, if there was enough pain, how did you manage it?
Sure. So I probably should preface this with like I've also had my vulvar skin lasered, and so I feel like I had that done prior, and so having gone through that kind of, rehab and like the pain of that procedure, I would say I wasn't at all shocked by kind of the aftercare
Okay.
of this procedure. And I would say more so pain. I think it's just a lot of just like discomfort from the swelling aspect.
Okay.
So I don't remember there being a lot of true pain. It's I remember there just being a lot of pressure from the amount of swelling
Makes sense. Yeah.
and maybe kind of like a dull throbbing, you know what I mean,
Yeah.
sensation, but not a whole lot as far as like sheer pain. And then the itching with the stitches. And so I feel like and part of it too is like when you have that much swelling and everything was swollen, like my outer labia were
I
swollen,
would
like the whole
imagine.
area was
Yeah.
swollen. It's almost like protective in a way because it's like there are other tissues swollen kind of over the area that they've operated on. So I would say the trickiest thing for me actually was like getting access to that clitoral area to put emollients and stuff on it
Okay.
because everything was so swollen and so kind of like closed up and
Yep.
tight, that you just have to really be gentle and sensitive when you're trying to spread things to get access to where you need to. So I would say more so than pain, it's just very, very like overly sensitive and kind of
Mhm.
throbby is what I remember.
Yeah, that makes a lot of sense. And then let's talk a little bit about satisfaction with the procedure, but I want to
Yeah,
talk about that in a few ways. So,
sure.
there was a couple points that you mentioned where like the clitoral adhesions were troublesome or bothersome to you. So there was one part or like one component which was like a painful discomfort component, right? So like if this is my little vulva puppet, this pink part here is the glands. This dark navy blue is the hood. And so basically it's fused over so tight such that if you try to pull it up and retract, you can't expose it. There's not a lot of mobility. And for some people, that will cause like a tightness, a discomfort, a pain component. And then there's also the other side that I want to touch on is like the sexual health side. So you talking about how it kind of felt desensitized, like there was less sensation than there was before. And again, that happens because this hood is scarred over the glands and the glands is so sensitive. So it's almost like, I always explain it as I'm putting a glove on my hand. So I hold my water bottle right now with my bare hand. That tactile sensation that I get is quite sharp. If I took a pair of ski gloves, put that on my hand and held the water bottle, I would still feel it a bit, but not nearly as distinct, as sharp, as clear as when I'm holding it with my bare skin. So it's something comparable to that, which is why some folks will say, they notice a reduction in sensation or a complete loss of sensation. So I'm curious to know how satisfied you are with the procedure in those kind of two ways. So one, that kind of pain, discomfort, achy component, and then from like that sexual health side.
Sure. So from the first aspect, from kind of the pain achy, um, I would say that completely went away because I think that just was really based off of like anatomically, like what you just demonstrated, what was
Yeah.
kind of happening. And I would say too, and maybe I don't know if this was my surgeon or if this is just in general. So like when you have preserved anatomy, I would say, and you truly have that hood function where it kind of comes down like you had
Mhm.
demonstrated, and then it kind of can be lifted off. That's great. I think post procedure, I don't know how much they can really keep like a hood type motion, or at
Mhm.
least for me, I think because of the fact that they like separated and then kind of brought new edges
Yeah.
down, mine I would say is more of like a shutter. Like so
Oh,
the actual
okay.
anatomy kind of changed
Right.
as far as I think a lot of people who have a clitoral hood, you're out there, you're walking, you're running, you're doing things and that hood is still protective, right? Until you
Yeah.
really don't want it to be and until there's
Mhm.
stimulation that kind of pushes it out of the way versus post procedure now, like if I were to sit down and do a straddle sit and if I were to be stretching, if I like, I wouldn't even really need to separate my skin. Like you could visually
I
see my
see.
clitoris
Yeah.
because of just like how the anatomy then has to be.
Mhm.
Um, so I think it still works. I
Yeah.
think that like, um, I maybe wasn't expecting that type of change, I guess, in just kind of how that skin covers it.
Mhm.
But it still kind of provides the function that it needs to. And luckily, I think the thing is like the clitoris, when it is exposed, like it's so sensitive. Like, you know, you go from having it be hidden and buried and, like you said, completely desensitized to all of a sudden, like not only is it exposed, but it's like it's been almost like I don't want to say a layer of it has been taken off, but that's kind of like when I would look at it, it looked like fresh, right? Like it looked like it was like a fresh clitoris now. And so luckily in the beginning that felt too fresh and it was too, you know, too sensitive. But with time that has gotten a lot better. And I would say kind of leading into the sexual function of things. Um, so it was a little frustrating because I think in my mind, I was like, perfect, sweet, I can see it. It has room to like breathe now. We're going to be able to go back to like what worked. And I could not go back to what worked. Because if you think about it over time, if your clitoral hood is fusing down, you're needing to use more and more pressure, more and more friction, more and more stimulation to get out, to get that stimulation that your body needs to get that sensation. And so what I realized was like the amount of pressure or friction that I was having to apply to orgasm pre-procedure was way too much post-procedure. Like post-procedure, like you really need to take it slow and you kind of need to retrain your brain and come into it with like fresh eyes. Because I made the mistake like the very first time of being like, I'm just gonna like kind of go back to my old routine and like I'm so excited and this is gonna work. And I was very frustrated because it after probably 10 seconds, I was like, whoa. Like it's overly stimulated. I need to stop. Like this isn't pleasurable. This is like uncomfortable feeling. And so I was a little frustrated with myself for not really like realizing that for some reason. Cause then I was like, oh gosh, like, because I was mad and I was like, great, like I just had this huge procedure. Like I went, you know, I had all the swelling, I did all this aftercare, and now like it still doesn't work. It still doesn't work. You know what I mean? Like I was just like so frustrated. And then I really took a step back and I was like, okay, I just need to like slow down a little bit. You know what I mean? And you really need to take baby steps to like walk back into it. Um, and so I do think like at this point in time, so I mean, this was I I think 2 years ago about like I have no regrets about it. Um Definitely like have regained sexual function, orgasm. One thing that I will note, and I don't, this is just like a personal preference for me, was like during that time where I was trying to let things really calm down. I think maybe just from like working in healthcare, you know that blood flow to an area is good. Blood flow to tissues is really good, helps them heal. But at the same time, it's like now you have this clitoral area that's so sensitive. So I brought it with because I just wanted to like show people. So I actually got something, and of course the
I
names
saw
are so,
Satisfier and I knew.
yes. So like this is what it looks like. It's called the Satisfier Pro 2 Air Pulse. So I had never had this like pre-procedure, and a friend actually suggested this to me and they were like, this might be really useful for you. And the thing I love about it, so it's, you just kind of put it over your clitoral area and it vibrates. And then as you kind of increase it, it does these little like air pulses. And what I really liked about it is I feel like for people maybe post-procedure, or if they're not even having the procedure, is like it's completely frictionless. And I feel like frictionless is like our Bible, right? Like we don't like, how do we prevent extra friction? And when you need clitoral stimulation to orgasm, it's like impossible. You know what I mean? Like there are some situations where you're like, the friction is what makes you orgasm, right? Like that is the stimulation. So I think that that was something that I definitely started using kind of in that interim when it was too sensitive yet to really have a lot of friction or like manual stimulation, but yet you want to have like intimacy with your partner. I feel like that was like a godsend because I feel like it didn't hinder my recovery at all. And then you still kind of check that box.
That's amazing. And yeah, I recommend that one pretty much to everybody, honestly, but especially with LS skin, because like, even if you don't have the lysis procedure, our skin, people with LS, is a little bit more prone to tearing, to fissuring. And so sometimes, people will take like a wand, like the magic wand, the Hitachi, and just like jam it onto the clitoris. And it's so intense, it's so hard, it causes a tear. So these kind of like air pulse toys, doesn't have to be the Satisfier necessarily, but these air pulse toys, to your point, like it's frictionless. And I thought it was strange at first when I was reading that. I was like, air pulse? What?
Yeah.
Like someone's just blowing air on it. Like how is that going to do anything? And it's like my favorite. So
Mhm.
yeah, like I think that's just a great recommendation for people with LS, but definitely like post lysis of adhesions as you're kind of recovering and trying to kind of, like you said, like baby step and like slowly get back into intimacy, whether that's partnered or on your own first, using something like these air pulse toys can be a nice way to get that blood flow to kind of experiment with, your new body, but also not cause harm to the area either. Or like you were saying, kind of just like overstimulate it and then just have like
Mhm.
this knee jerk, oh, fuck it reaction. Cause I mean,
Mhm.
fair.
Right.
Like I'd probably have the same thing. Like it's a pretty like, it's a small procedure, like if you think about the body surface area, but it's a big procedure if you think about where it's being, operated
Mhm.
on, technically speaking. Like the clitoris is a really important part of our body. And, if the surgeon messes up, we could potentially lose all function. So it's really, really scary. And like to your point where you're like, oh yeah, the morning of I was freaking out. I was like, oh yeah. Oh yeah, that would have
Yes.
been me. What the
Yeah.
hell did I just sign up for? And I think that is kind of that like
Mhm.
type A kind of tendency, is that like then it's like, oh wait, but what if? And then we run through those like what ifs, and what if this actually makes it worse, and maybe, and all these what if scenarios that we can
Mhm.
drive ourselves insane with. Um, but yeah, okay. So I want to kind of close us out with any advice or recommendations to anyone who's about to have the procedure, or to anyone who's even thinking about getting the Lysis of Adhesions procedure.
Right. So first of all, I guess I would say for people who are thinking about it, don't be afraid to like reach out, you know what I mean, and talk to a provider about it and try to find who around you would be able to do it that's like seasoned and is experienced. I think that there's unfortunately kind of this huge double standard in healthcare regarding like sexual function. And I think, I work in urology and I see a lot of men who come in with like sexual function complaints. I have never had a woman tell me a sexual function complaint, you know what I mean? And because there are a lot of things that women's bodies have that I think we kind of triage as more important. And so I think for people who are thinking about it, like if it's bothering you enough that you're thinking about it, I think it's worth doing a consult for and talking to somebody about it just to hear what they have to say, hear about how they do the procedure. Because if you feel like it's impacting you emotionally or it's impacting like your intimacy with like your partner, I think it's definitely worth just advocating for yourself, especially. And I think in my situation, I think my age played into it as well. If I were to have been 60, 65, and I was postmenopausal and maybe I like the sex life between my husband and I wasn't maybe such a priority at that point in time, I don't know if I would have gotten it, because I think that sometimes like as we age, that becomes less and less of a priority. And so I think sometimes, younger patients with LS maybe tend to go more for procedures like this, where they want to kind of regain some of that because they do feel like they have a lot of these years where they're going to be very sexually active. So I would say don't worry about asking somebody about it, talking about it. There aren't a lot of people, honestly, who are super familiar with it. Like I work in healthcare, and if people were very surprised when I would like ask around about it, and they'd be like, "Well, I've never, no one's ever asked me about that." And these other things, which I think is just funny because, we see men a lot who have like phimosis of their foreskin, where their foreskin doesn't retract,
Mhm.
literally anatomically the exact same thing. But that
Correct.
men's complaint gets a lot more attention than women saying, because, and also a lot of time providers like aren't taking the time to visualize the clitoral area during a pelvic exam.
True.
And that's one thing that I talked with my program about a lot when we were learning about LS and about pelvic exams is I said, hey, when you do a male GU exam and you are taught to retract that foreskin in an uncircumcised male, when you do a pelvic exam, you need to be retracting that clitoral hood because it is synonymous, and you need to be treating patients the same, and you need to be finding this issue because it is out there. Um, so I think, just advocating for yourself, trying to find somebody around who has done it before, obviously, talking to your partner about it too. You know what I mean?
Mhm.
Because like hopefully you have a partner that's really supportive. My partner is extremely supportive, but like they are going to be your voice of reason, like as it leads up to it and after, if you decide to do it. You know what I mean? Like as you start to get maybe a little bit of those cold feet prior and then afterwards, I really leaned on my husband being like, oh my gosh, like, should I do this?
Yeah.
And my husband was like, you've literally talked about this for so long. You've met with the surgeon. You know what I mean? Like they really bring you back down to earth a little
Mhm.
bit. And then, you know, having their support afterwards, and especially like as you try to go back
Yeah.
to like your sex life, because they are going to need to be on board and they are going to need to understand that you just had this like semi-minor but really major when it comes to sexual function procedure, and you're going to have to start over. Like you're going to have to start completely from scratch in trying to figure out what you need and what works for you, and you know, to try to have fun with it from that perspective. I found it stressful. I feel like I'm just somebody, you know what I mean, where it's like you want things to be instant and you want them to
Mhm.
work.
Of course.
But just knowing that there is going to be, it's going to take time. It's not going to be this instant fix where afterwards all of a sudden the swelling's gone and you go and you're able to orgasm just like you did, you know, your same routine. Just knowing that that is going to change, but hopefully that that changes for the better. And then, I mean, personally, like I felt really comforted by just knowing that the surgeon and I had talked about a more conservative approach over a more drastic approach, because I told him, I was like, I would so much rather have this procedure and look at my clitoris and be like, I can kind of see what they did, but it doesn't look like they did a whole lot, than all of a sudden be like, oh, whoa, like
Yeah.
this,
Too
this is so
much.
drastic. Right.
100%. Yeah. So number one, absolutely right. We don't want just anyone cutting this part of our bodies. It is, quote, a minor procedure insofar as it's not open heart surgery, but the clitoris, you know, is dense with thousands and thousands of nerves, and you really want to make sure that you know, your surgeon is experienced. They've done this many times before. They have good, you know, outcomes overall. You also want to make sure that you're getting it done with a surgeon who's familiar with lichen sclerosus skin. So clitoral adhesions can happen to people with LS, but it also can happen to people without LS. And so some surgeons can do this procedure, but not be familiar with lichen sclerosus skin. And I always want somebody that's going in with LS to have their doctor be very familiar with lichen sclerosus, because our skin is different and is going to need different considerations than somebody without LS. So definitely take your time in finding a good surgeon, a surgeon that you trust. And again, you want to have that trust because you want to be able to have that conversation, like you said, where you were able to advocate for a more conservative approach. Whether that's what you
Mhm.
want to advocate for or not, you want to be able to convey those really important pieces to them clearly so that they will respect that, right? That's really, really important. And then the other thing, you know, is, you know, to get the consult. I agree. I always tell people it can't hurt to get a consult. A consult is not you agreeing to a procedure or saying no. You are there to get information so that you can make an informed decision about your body. You can get the consult and say, cool, that was great. Thank you. I'm going to digest that information and I'm going to think on it. And you can take that time afterwards to really think through, is this important to me? Now, if your fusing and adhesions cause pain, you may be more motivated to go forward with it because typically humans want to avoid pain in this sense, right? So if there's a way that we can undo or stop that pain, then great. Maybe you don't have the pain component, but you have a sexual health component. Then asking yourself the question of, you know, how important is my sexual health for me? Because for some folks who may be asexual, that may not be a big thing that bothers them, right? Like, and if there's no pain, they may be like, you know what, like it's cool. Like I could just have,
Mhm.
you know, a fused clit. I don't mind if I can't visualize the glands. I'm in no pain, no discomfort. And, you know, my sexual health, well, that's not really a thing that I prioritize. So that's okay for me. Conversely, you know, if you're having sexual health issues and it is impacting you and it is important for you, then, you know, again, okay, maybe that's a reason to go for it. So really thinking these things through. And again, like you don't have to make a decision then when you get a consult. I mean, you can certainly. Some people are like, I already know that I'm going to say yes, but I just want to like go in and ask my questions.
Mhm.
But regardless, a consult is just to get information to make that informed decision about your body. And then I think finally that piece about the considering the partners, if you are in a partnered relationship, that is a really important thing to consider. And to your point, not just pre, but also during and after, and how you're going to navigate your sex life as you kind of heal and, exploring intimacy in this new way. And one thing I might recommend for people is checking out a book called When Sex Hurts. It's by doctors Kraft, Pukal, Goldstein, and Goldstein. They the book basically talks about all different pain conditions that can affect the genital pelvic area, including lichen sclerosus. But the chapter that I'm specifically thinking about is kind of towards the end of the book. And it's geared towards partnered relationships and intimacy. And it's really talking about how to kind of navigate that space of exploring that sexuality again when there is no more pain, when there is no more dysfunction, when we've removed all that. Because it sounds great, it sounds easy, but it's actually not. It's actually really complicated. It's actually kind of messy, and there's a lot of things to kind of consider when you're going to be moving through that. So that could be something for both you and the partner or partners to kind of read through as you're navigating that stage of your journey. Again, Chelsea, I can't thank you enough for coming on and sharing your story. Before we close out, is there anything that you wanted to mention, but that for like some reason we didn't get a chance to talk about when it comes to this topic?
Um, there wasn't a lot, like you had said, there isn't a whole lot as far as like firsthand accounts of this out there on the
Mhm.
internet when you're trying to research it. It's really just kind of accounts of like how they do the procedure itself.
Yeah.
So yeah, I'm just glad we were able to talk about it today. And, hopefully I can shed a little bit of light on kind of how it went and things for maybe people to consider if they are considering it. And the one thing I would just say is like, if you do choose to have it be done, really try to not panic after and really try to not be like, what did I just do? You know what I mean?
Right.
Because
Trust the
it was a
process.
procedure. It
Hmm.
was a procedure, you know what I mean? And time will make it better. And just kind of and making sure that you go back to or you get specific advice on what your skincare routine should be involving like your steroids and stuff. Because, sometimes there's concern also like, do you want to be putting an immune suppressant on fresh skin that you're trying to
That's
heal?
it.
You know what I mean? Like, there are all these considerations where you start to think, is that what I should be doing? So, yeah, just really making sure that the plan they give you is individualized to you and isn't just their general,
Right.
post procedure recommendations for sure.
Yeah, that's a great point. Really getting clear on what am I doing when I leave with my treatment plan, whether it's topical calcineurin inhibitor, topical corticosteroid, whatever it is, you want to know how you're going to be using that moving forward 100%. Like it's all
Hmm.
fine and fair to have that general one, but I would definitely ask them for like explicit instructions. And same if your lichen sclerosus management plan includes any other topicals like topical estrogen, anything like that. Also asking, are you taking a break from your estrogen? Can you use it as normal? So yeah, great, great
Hmm.
advice there, and definitely trust the process. I think even just hearing your account is helpful in that it kind of helps set expectations a bit. So like, for example, if I was going to get this procedure tomorrow and a few days later I was like having that unbearable itch, I would kind of go back and hear your voice talking about how that's a normal part of the procedure. And as much as it sucks, like it will stop. And it's, because of the stitches and all of these things. So I find that for me with my health anxiety, when I can like rationalize what's going on and also simultaneously know that this is not forever, that can really get me through
Hmm.
periods where I might otherwise just spiral and think like, okay, I need to check myself into the hospital. So knowing that, intense itching can be a thing, knowing that like aching and stuff like that can be a thing, preparing yourself mentally, perhaps even to see the vulva all swollen, because I could imagine that's kind
Hmm.
of jarring to see. That area all swollen and stitched up, that's not exactly something that we're all prepared to see. So, kind of bracing yourself for that as well. But I think you gave so much incredible advice throughout this conversation. And I think it's going to help a lot of people. So thank you again so much.
Yeah, thank you.
Yeah. So that is it for this video. We will catch you in the next one.